All right. Hello everyone, this is Dr. Kashish Grover, your PSM faculty. So guys, I am starting the INICET Predictor series now. Everyone, are you there? Yes, everyone. Yes, everyone, are you there? Can I start? Now, the first question here, a 34-year-old male presents with diagnosis of tuberculosis, but rifampicin and isoniazid resistance. Now you have to tell the correct regime. You have to tell the correct regime. Hello everyone. Hello Dr. Anuj, Jatin, Saurabh, Vaishnavi, Dr. Kushtab, Somika. Hello bacho. Hello everyone. My hello to all of you. I am starting Predictor series, although from last 2-3 exams in INICET, PSM was very much unpredictable. But still, I'm trying my best on the basis of recent updates. Secondly, on the basis of recent topics, right? So everyone is saying here B. Yes, that is correct answer. First of all, you have to tell me that if resistance with H and R is MDR. Resistance with H and R is MDR. So, and H and R with any FQ, this is pre-XDR. This is pre-XDR. Now, according to the recent updates, for MDR, we use B-PAL regime. For MDR, we use B-PAL-M regime. B stands for bedaquiline, tritonamide, linezolid, and moxiflox. This regime we give for 6 months. But if it is a case of pre-XDR, so this is the situation pre-XDR. If it is a case of pre-XDR, we know that pre-XDR means resistance to any one FQ. So FQ is already resistant. So what I am going to do here is, that's okay, I can give B-PAL regime for 6 months. Guys, if you are preparing for INICET, this is the recent update. Although WHO, since many months, WHO is following B-PAL regime, but India has adopted only recently 1 month ago, right? Anyone here? So this is the thing regarding B-PAL and B-PAL-M regime. I hope there is no confusion. Can I go ahead? Yes, everyone, can I go ahead? So this is our first question, and my first topic here is new. My first topic here is new TB MDR treatment. So this is my first topic. Now everyone, I am coming to the second update, and the second update is, so there are, okay, let's read out the question, and you answer first, right? Let's read out the question and you answer first, then I'll go ahead. The question says there are 3 individuals. They want to inquire about PMJ. What is PMJ? Hashtag Ayushman. Hashtag Ayushman. So this topic is related to the recent update in Ayushman, right? So Ayushman is basically a health insurance. PMJ is a health insurance scheme. So there is one person, Mr. Rajesh, 38-year-old man from rural area, Mrs. Sunita, 72-year-old, and Mr. Vinod, 45-year-old. Among three, Mr. Rajesh is listed as BPL according to SECC 2011 update. Which of the following statement is true regarding these three individuals for PMJ benefit? Guys, PMJ benefit is for BPL families according to SECC 2011 database. That is point number 1. 5 lakh insurance, that is point number 2. Cashless insurance, that is point number 3. But this is old point. Now the guidelines say more than 70-year-old, any person belonging to any rural or urban, rich or poor, more than 70-year-old is also added. This is new update, hashtag update. So this is an update related to Ayushman Bharat. So guys, yes, everyone, what should be the answer here? Mr. Rajesh belongs to BPL. Mrs. Sunita, she is more than 70. So yes, Dr. Saurabh, Dr. Divyamsu, Dr. Kaustup. Okay, I'm sorry, I'm not able to do the correct pronunciation, so I'm going to call Dr. Moore. Alright, Dr. Anuj. Everyone. Yes, the correct answer here is B. Why B? Because one is BPL, another is more than 70. I hope this is a good question, and I think this is important for your INICET exam, right? So this is our update. Now, okay, another question. So HDI hashtag. So as I told you, I'm going to do a mix and match of updates, PYQ, and the hot topic. So this is a hot topic. Be it INICET, be it FMGE, be it NEET PG, any exam, HDI is a favorite topic. HDI is the favorite topic. There are some topics which are favorite. HDI, the toxin, and the adulterants, BOA. These are famous questions, favorite questions. Okay, everyone, please give the answer. I'm going slow because I want you to answer, because I want you to read the question and try to attempt the question. Alright, so which of the following is most accurate? So we are asking about most accurate. HDI is simple, arithmetic average. Guys, what about this one? Yes. Is it arithmetic average? Is it arithmetic average? First, let me dissect this one. Is it arithmetic average? No. If you have attended my class, I have told you that this is geometric mean. This is geometric mean. Mean is of 4 types. If you have attended my class, my B2B, I have already told you, mean is of 4 types. Arithmetic mean, geometric mean, harmonic mean, and weighted mean. Among these 4 means, geometric mean is used to calculate HDI. So this is a false statement. The education index only uses mean year of schooling. Only mean year of schooling, everyone. No. Education index, it uses 2 components, mean year of schooling and expected year of schooling. So this is also false, because here the statement is written only. The income dimension uses GNI. Yes, this is true. GNI is used, not GDP. Life expectancy at 1 year is used. This is also false, because life expectancy at birth is used. Very good, Dr. Amrita. Very good. Mean and expected. Dr. Moore, very good. It is a geometric mean. Superb. Asmita, very good beta. Vibhor, very good. Saurabh, Akanksha, very good bachche. So the correct answer here is option C is the correct answer. So are we going good? Some twisted questions. Yes, very good, Dr. Asmita. That's the mnemonic. So what's the mnemonic? Dr. Asmita is telling us the mnemonic for HDI. Hey, don't kill at birth. K stands for knowledge component. It includes two things: mean year of schooling, expected year of schooling. I component includes income. L at birth means life expectancy at birth. The income components includes G and I. So this is regarding HDI. Very good beta. Now, all right, again a twisted question. So another 5-star topic, hashtag study design. Hashtag study design. This topic is very important and this is a PYQ, hashtag PYQ. A very 5-star topic, study design for INICET, for NEET PG. In every exam, expect one question. All right, so let me check who is going to answer first. I am waiting for your response in the chat box. Let's see who answers first. Okay, 10, 9. Okay, Anuj is saying D. Good. Asmita is also saying D. D. Dr. Moore is saying case cohort. Saurabh, Dr. Saurabh is saying D. All right. What about others? Yes, everyone. What about others? You gave correct answer. B. More, you gave correct answer. B. Amrita, very good. B. And the correct answer is B, case cohort study. And B, and the correct answer is very good, Asmita, very good. Now, so guys, no Asmita, they can select in the beginning also. They can select in the beginning also, right, Asmita? They can select in the beginning also. Now, let me dissect. Okay, first of all, okay, so listen patiently. I'm going to cover all the study designs in just a simple format: case, cohort, and nested case control. Case cohort and nested case control. Guys, you have to just listen to the story. That's it. Just listen to the story and these topics will be a cakewalk for you. Just listen to the story. So guys, I want to do a study. I want to do a study for H. pylori. I have this group of people. And now I am starting the study. So this is my cohort. They are baseline disease free. When I am starting the study, they are disease free. So I have to divide in two groups: E plus H. pylori positive, E minus H. pylori negative. They are 1000 people. To know their H. pylori status, I need to do H. pylori test. The cost of one test is 2000 rupees. In the beginning, just to decide whether E plus or E minus, I have to spend 2000 on each, because 1000, they are 1000 people. 20 lakhs I am going to spend initially at this phase. I cannot afford 20 lakhs in the beginning of the study. So what I will do is, instead of determining their exposure status, I will include these people and I will follow them. Right? I will follow them because I have now collected their blood sample. I have now collected their blood sample. Right? After, say, after 10 years. After 10 years, suppose we have 100 patients. So basically they are my cases. And from this group, I am going to choose a sub-cohort. And the sub-cohort is disease-free, so they are my control. So basically, this is D plus and this is D minus. What is the benefit here? The benefit is the expenditure. Initially I have to spend 20 lakh here. Initially, I have to spend 20 lakh here. Now, when I know these 100 patients, they have cancer, I will ask my team to go and check the collected blood sample which we collected 10 years back and we stored in minus temperature. Very good, Asmita. Economic benefit. This is case cohort. Now what is nested? Nested case control. This is your cohort. Cohort is nothing, just a group of people. Now from this cohort, I have also collected their blood sample. Till this point, everything is same here in both. We collect the sample, we store it. We don't know the exposure status. We collect the sample and we store it. Now, suppose after 2 months, I have a case here. I will, at that same time, I will ask my team to check the exposure status, to check the H. pylori in the stored blood. And what I will do, I will ask my team to choose a person who is disease free from this group. Because suppose I have 1,000 people here and one person got the cancers, there are still 999 who are cancer free. Now I will compare them. Suppose after 6 months I have another, suppose this is D plus D2 plus, another case. After 6 months I will again find a person who is disease free. The moment I am getting a case, I am comparing it with, the only difference between case cohort and nested case control is we are comparing controls at the end by a sub cohort. But in nested case control study, what I am doing is the moment I am getting a case, I am finding a control and I am comparing them. This is the only difference between case cohort and nested case control study. Understood? Everyone, is the concept clear? If the concept is clear, can I see some happy faces? Can I see some fire in the chat box? Yes guys, if the concept is clear, okay, I'm bad at drawing the fire, but I hope you understood the fire. If the concept is clear, can I see some happy faces, some fire in the chat box? Can I see some fire in the chat box? Good, very good. Now we will discuss other studies also. So I am going to draw the schematic diagram for all the study designs. Now coming to retrospective cohort and MB-spective cohort. Just listen to the story. You need not to worry about the technical language. We are medical students. You are medical student, right? We are medical students. We need not to go in the technical languages. Just learn the story and find the keyword. That is our job. We need not to go in the technicalities. We need not to go in the very much, technical language, because at the end, technical languages, they make us bored. They make the topic difficult. Just listen to the story, find the keyword in the MCQ, and trust me, no study design question you will ever mark wrong if you follow this. Now, next, retrospective cohort. Okay, so my question. Good, Asmita. Asmita, you are giving the keyword before I start. Very good, Asmita. Asmita, my question to you. What is the drawback of cohort study? 20 years follow-up. What is the drawback of case control? Recall bias. So, in retrospective cohort study, suppose we are in 2024. What I'll do is, I want to do a study where I want to know the effect of aniline dye on bladder cancer. What I did. So, those who worked in aniline dye industry in 2004, I went to that industry. I requested the owner of the industry, the manager of the industry, please give me name of 100 employees who were there in 2004. Those who were there in 2004 working in your industry exposed to aniline dye. The manager gave me a list from the record. Yes, Asmita bache, record is the keyword. So the manager gave me a list. 100 people who were working in that industry. This is known as D+. I'm sorry. I'm very much sorry. E+. E+ means exposed. I requested the manager again, sir, please give me another list for the clerical workers in your industry, those who were not directly exposed to the dye. In our medical college also, we have two types of staff. One is teaching staff, your faculties, and one is non-teaching staff, the clerical staff. We requested them to give the record of clerical staff as well. The clerical staff is working there, but they are not exposed to aniline dye. Now, these are the 100 people and these are 100 people. We contacted them in 2024. We are in 2024. We called them, everyone we called them. Whether any feature of hematuria, whether any feature of bladder cancer, if they say yes, I mark D+. If they say no, I mark D-. Those D+, D-. So this is retrospective cohort study. Am I doing a follow-up here? I'm not following them. So I'm not spending money, I'm not spending much time. And second thing, do you have a chance of recall? Okay, what is the drawback of case control study? Recall bias. We don't have a recall bias here. What is the drawback of cohort study? The long duration, the more time, more money, more you need people. This is also not here. So this is retrospective cohort study. Technically, I can say, yes, this is a mixture of case control and cohort study. And the keyword here is record. Now coming to MB-spective study. Now the MB-spective, so Dr. Asmita said, sir, you don't know, aniline dye takes 40 years to develop cancer, and now you are just telling me that in 20 years they will develop cancer. How is it possible, sir? Aniline dye takes 40 years. You cannot ascertain it in 20 years. Okay, I said, Dr. Asmita, okay, please calm down. Let us follow this group. Who is this group? Technically, the exposed one, disease free right now. But the probability of developing disease in future is not negative here. Who is this? The person, they are non-exposed. So now I said, Dr. Asmita, now you follow them for 20 more years. She said, okay, I'll follow. So we did a follow, and after 20 years, those who developed the disease and those who did not develop the disease. So this whole is MB-spective, a mixture of, yes everyone, this is a mixture of retrospective, till this point retrospective and prospective. Retrospective and prospective cohort. This is retrospective and MB-spective cohort. Is the concept clear, bachcho? Is the concept clear? All right. Now, if the concept is clear, I will go to the case control study, the simple case control study. Here we are in 2024, we take cancer patient and we ask them about their history of exposure in past. We are taking cancer patient and we are taking the history of exposure in past. Similarly, suppose I have 100 lung cancer patient, I will include 100 controls, those who are free of lung cancer. I will not follow here. I will just take the history. So we take history of exposure from diseased, which are known as cases. So this is the keyword. Whenever you are reading the question, read this. Taking history of exposure from the cases. Yes, very good. Here the drawback is recall bias. If I ask you what you had yesterday, 2 days back, 3 days back, you won't be able to tell. How you can expect this person will tell you 40 years back, 20 years back? So recall bias is the main problem here. Okay, now coming to the last study design, cohort study. In cohort study, we have exposed, we have non-exposed. Actually, we have a group which is known as cohort. Among the cohort, there are some exposed and there are some non-exposed. We follow them to know whether they developed the disease or not. So we are in 2024, in future. So we want to know what happens in future. We do a follow-up. So we do a follow-up. If you are doing a follow-up, for 20 years, you have to spend money, you have to spend time. So this is time and money consuming. But there is one benefit. If you are following them, you can tell me about temporal association. You can tell me about natural history of disease. Yes, so here we have attrition bias. What is attrition bias? Loss to follow up. Very good, beta. Very good. Now, 2 more studies I want to tell you. Now, suppose there is one group. Now, next is parallel RCT. Next is parallel RCT. So you have a study population here. Out of the study population, so you have a total population here. Out of this total population, you are choosing study population. So parallel RCT, this is experimental study, right? So you have chosen a sample population, or you can say, so total population, better to write here sample population, right? So this is a total population, but I am going to do my study on the sample population. This sample population I am going to divide in two groups, group A and group B. Group A, where I am giving old drug. Group B, I am giving new drug. I am going to test old drug and new drug. If I am doing till this point, if I am doing the study till this point, this is known as parallel RCT. So basically my topic is RCT. But if after this point I am doing a crossover, earlier the group which got new drug, now that group will get old drug. If you do the study till this point, this is known as crossover RCT. This is known as crossover RCT, right? So this is RCT, this is cohort. So I have explained all the study designs in a very concise manner, right? So when we do a crossover, we wait for a time. That time is known as washout period, because if there is effect of previous drug, we want it to eliminate. This is about, all right, guys. I think this topic you might get confused, but can you please attempt? Any guess? Meta-analysis. Meta-analysis is a 5-star topic for INICET. 2 years back, 3 years back, they used to ask this topic very frequently. But from last 2-3 years, they are not asking any topic on meta-analysis. They have asked many topics. They have asked the sequence, they have asked the step, they have asked which of the following is not the step here. They have asked the definition of meta-analysis, but this they have not asked. Once they asked this in INICET MDS exam, dental examination, once they asked this in INICET. All right, heterogeneity. Heterogeneity. Guys, what is heterogeneity? In meta-analysis, there are different studies by different researchers, and we compile them all, This is meta-analysis. So here, heterogeneity, there is difference in these studies. They are not same, they are not similar. They have some changes in them. This is known as heterogeneity. Now, they're asking about heterogeneity in meta-analysis is measured by G-stats. No, G-stats is for effect size. Good, Asmita. G-stats is for effect size, and it is the I-square stats which measures heterogeneity. So the correct answer is C. Now, high heterogeneity in meta-analysis suggests that studies included are similar. No, high heterogeneity means they are not similar. And there is one point, when there are high heterogeneity, fixed models are not preferred. Random model is preferred. Random model is preferred over fixed model when we have high heterogeneity. Right? Just 3 points I want to learn here. Point number 1, for heterogeneity I square, for effect size G stats, and third point is random model is preferred over fixed effect model when there is high heterogeneity. And for heterogeneity, one is I square stats and second is Cochrane Q test. Cochrane Q test. A 32-year-old man presents after being bitten by a pet dog. Yes, pet dog. And the pet dog, all right, and bleeding at site is present. So bleeding at site, so that means this is a category 3 bite. Whenever we have bleeding, it becomes a category 3 bite. But it is by pet dog, so this is to remember. So focus on the keywords. The patient is sure about the dog's up-to-date vaccination status. So dog is vaccinated here. And the patient has no history of previous rabies vaccination. Most appropriate management, guys, dog's vaccination status does not alter our management. This is category 3 wide. We need to give immunoglobulin. There is no history of rabies vaccination, so yes, immunoglobulin should be given. The third keyword here is the dog is fully vaccinated. That doesn't matter. Even if the dog is fully vaccinated, you treat it like a stray dog, a fresh case. So here the correct answer is A. VVM is essential tool used. So hashtag PYQ, hashtag high yield. VVM is a very important topic, and this is for temperature exposure. This is for temperature exposure. It does not tell us exact temperature. No, not exact temperature, but yes, temperature exposure, high temperature exposure. So guys, this is VVM, category 1, category 2, category 3, category 4. Category 1 and 2 use the vaccine. Category 3 and 4 discard the vaccine. Hashtag PYQ. Guys, this is the filariasis case, the lymphedema, and whenever there is lymphedema, so the lymphedema limb is prone to the wounds, the infection. So we say that frequent washing to be done. So here this is tertiary prevention. Here this is tertiary prevention. Why? Because the disease is beyond early stage now. The disease is beyond early stage, and to prevent the disability, now the next is, all right, anyone, 28-year-old farmer gave history of 5-day history. So agent is Orencia susugamushi. This is true. A dark scab-like region at the site of louse? No, this is mite. Sugar. Trombiculid mite. People who are treated with doxycycline usually recover quickly. Yes, that's correct. Doxy or azithro, both can be used in case of severe. And yes, this is a case of scrub typhus. This is Ishar. And Ishar, so this is again a high yield topic. You know, AIMS, they love scrub typhus. Last year, 2-3 questions. Good, Anuj. Epidemic typhus, louse. Alright, what about this one? So this is a hashtag clinical. One student was asking about root cause analysis. So Ishikawa chart is used. Okay, what about this one? So there is a 3-year-old child. Okay. Fever, cough, runny nose, guys. Conjunctivitis. All right. Koplik spot. Yes, Koplik spot. Asmita, Akanksha. Everyone is saying A. Guys, I want to tell you about measles. So, measles, suppose here sign and symptoms started. And suppose this is exposure. Now, this period is known as incubation period. This is around 10 to 14 days in case of measles. The sign and symptoms starts in 3 phases. This is phase 1, this is phase 2, and this is phase 3. I teach in my class the phase 3 is recovery phase. This phase 2 is eruptive stage. This phase 1 is pre-eruptive. In pre-eruptive stage, we have cough, coryza. Classically, you will see the runny nose. Runny nose. In eruptive stage, you see rash. The rashes, they appear. Usually 4 days. Pre-eruptive stage is usually for 4 days. Now, 2 days before the appearance of rash, 2 days before rash, the patient gets Koplik spot. The patient gets Koplik spot. So the rash appears 4 days after the fever. So 2 days after the fever, or you can say 2 days before the rash, the patient gets Koplik spot. What is Koplik spot? The Koplik spot is a salt-like spot, the white spot, inner mucosa of cheek opposite to 2nd and 3rd molar. This is pathognomic of measles. So now there was one MCQ many years back. If they ask you the Koplik spot is seen in pre-eruptive stage or eruptive stage. So many students, they think that this is a rash on the inner mucosa, so this is in the eruptive stage. That is not true. Koplik spot is seen in pre-eruptive stage 2 days before rash. So this is regarding measles clinical presentation. So from the clinical presentation, we know that this is a case of measles. Now, measles vaccine, the strain used is Edmonston Zegerb. The strain used is Edmonton-Zagreb strain. Alright, Gerillinin, this strain is for mumps. RA27/3, this is for rubella. SA14-14-2, this is live JE vaccine. Live JE vaccine. Danish 1331 is for BCG. Guys, there is one more controversy regarding the JE vaccine. There is one controversy regarding JE vaccine. I want to tell you. There are many versions going. There are many versions going. Someone is saying the Genvac is the strain. Someone is saying SA14-14 is the strain. Someone is saying blah 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 blah. Guys, I want to tell you one thing. Listen to the story and you will get the full answer yourself. To end the controversy of JE, I am repeating again. Guys, JE, earlier the vaccine was SA14-14-2. This vaccine is a Chinese vaccine. The vaccine was manufactured by the China Sinovac company. And this was based on Chinese JE strain. The JE strain which causes more cases in China, and the strain was SA14-14-2. India from many years wanted their own vaccine because of two reasons. They wanted it to be an Indian vaccine and they wanted some Indian strain, because in India we are giving the vaccine, we should give the vaccine which can protect from the strain which is prevalent in India. Why do I want to give the vaccine which is prevalent and the vaccine for the strain which is prevalent in China? So India, Bharat Biotech gave a vaccine on Indian Kolar strain. This strain is more prevalent in India, in the Kolar regions of India, right? So someone correctly said here the mobile number, but right now I won't give you the mobile number. Just remember Indian Kolar strain. This was a live vaccine. This is a killed vaccine. This was given subcutaneous. This is given intramuscular. This was a freeze-dried vaccine. You know, this used to come in the powder form. And this is a vaccine, liquid-based vaccine. Right? JE, old JE you can say, or the live JE you can say. Is the concept clear now? Genvac is the strain. Genvac is not the strain, it is the brand name. Many people are saying Genvac is the new strain of the JE vaccine. That is absolutely wrong. With due regards, that is absolutely wrong. Genvac is not the strain. It is the brand name. Right? The strain is Indian Kolar strain. Understood? Can I go ahead, everyone? Now, one more thing I want to tell you about measles vaccine. I want to end this measles vaccine controversy doubt as well. Measles vaccine, guys, listen to the story. This is the birth of baby. So at the time of birth, the baby has maximum maternal antibodies. Maximum maternal antibodies. By 6 months they start decreasing. They further decrease by 9 months, and by 12 to 15 months they are significantly low. So there is one question. At 9 months we give under national immunization schedule. The first dose is given at 9 months. The second dose is given in India 16 to 24 month. So guys, at 6 month we can give a dose to more than 6 months in case of outbreak. In case of outbreak, many students, you know what happened 2 years back? There was one outbreak of there was one outbreak of measles in Maharashtra. So what they did, they took a decision to give 1 dose of measles vaccine to 6-month kid and more than 6 month, to 6-month infant. And next day someone told update, the schedule of vaccine shifted from 9 month to 6 month. That is absolutely wrong. 6 month is given. That is a protocol. Whenever there are outbreak, we give at 6 month. We can give at 6 month. Now question arises. Suppose you are giving vaccine to a 8-month-old infant. There's an outbreak there. So because there is an outbreak, you gave 1 dose. Now what to do? Should I give the dose at 9 months? The scheduled NIS dose? Yes. Even if you are giving the dose at 8 month or 7 month or 6 month, whenever you are giving the extra dose because of outbreak, you should give the 9-month dose. But there should be a gap of minimum 1 month. Suppose 8-month-old infant, you gave the dose because of outbreak and the scheduled dose is 9 months. So wait for 1 month and give the first dose according to NIS at 9 months. There should be a gap. Yes. Yes, beta. Saurabh, Somika, Asmita, Tarush, Anuj. Everyone is correct. We need to give the scheduled NIS irrespective of the fact whether you have given it or not. Right? Alright, so this was about the measles vaccine and this was about JE vaccine. So with this, I end this session. Thank you so much. And from last 2-3 years, PSM and INICET is totally unpredictable, but still I hope this predictor series is helpful for you. May God bless you all. Thank you so much for your patience. In case you have any doubt, you can reach out to me, case_PSM. This is my Insta ID. You can DM case_PSM. Because of very much occupied life these days, some messages are pending, but definitely I'll reply to all of you. All right, thank you so much, Bacho. Thank you so much. God bless you. Many wishes for the INICET exam, and I wish the best for you. May Almighty bless you all, and may you get your dream branch. All right, thank you so much.